pre-event massage for our adductor group. Now, once again, this is a group that gets missed, and it's so important. These adductors are so important, especially changing direction athletes, even our straight runners. You know, we've got the adductor magnus, we've got our adductor longus, so important, obviously, in hip flexion. You know, magnus is the inhibiting potential to the glute med if it's tight, so that's why we're going to incorporate this. Once again, these are broad techniques, guys, all right? We want broad. The great thing is here that we pick up all of this tissue here. We're both looking at vastus medialis. We've got the adductor magnus group here. We've got a little bit of medial hamstring, and then we've also got the adductor longus there as well. Okay, so once again, it's going to be broad. Here's our condyle. We're going to come off here. We're basically going to sink down, okay, and work all the way up. Obviously, get to that point there where we're going to slide off, back over to the medial hamstring, and back over again, all right? So once again, when we're working with athletes, working up in and around near the groin area, we need to be specific about our care and our intensity and our intention of what we're doing. But with most athletes, they'll be very used to this type of pressure and work. So side lying is going to be the best way to go here, because you can see that Kurt's nice and relaxed here. Okay, so we just work through this area. Once again, purposeful, lots of pressure, lots of broad pressure right across all the way up and back down again. And the great thing about this as well is that we can start to angle a little bit of the knee as well, and we can change the tension a little bit as well. That's not going to make that much of a difference as well, so we've got to make sure that we come right over the top, sweep across. This is a really great way for our athletes to get started, because I know we concentrate so much on our quadriceps and our hamstrings when we miss these vital areas, which is so important. I've had this discussion with many other therapists over my time, so very important. So up, cross, back down, over. Really, really simple approach to treating that adductor group and even part of the vastus medialis.
So if you even remotely enjoyed some of that content, please do me a favor and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.